This is a list of the 10 prescription drugs the Biden administration is now trying to cut the cost of for people on Medicare. They include drugs that treat diabetes, autoimmune diseases, heart failure, blood thinners, and more. According to the Centers for Medicare and Medicaid Services, these drugs alone cost the program $50 billion in the last year. Good evening and thanks for joining us here on News Center Maine at 5:30. I'm Zach Blanchard.
And I'm Chris Costa. Americans pay more for prescription drugs than any other country in the world. But now Medicare can negotiate with pharmaceutical companies to lower those costs.
News Center Maine's Alex Haskell joins us now to talk about the impact these price changes could have on people here in Maine. Alex?
Hey, Chris and Zach. So Senator Angus King is calling this announcement a huge victory for Americans. He says tens of thousands of Maine Medicare enrollees are currently on the 10 selected drugs. And last year, they paid an annual out-of-pocket cost of up to nearly $5,000 each. Now, Dr. Karen Saylor at Coastal Maine Direct Care in Falmouth says the 10 drugs selected are among the most commonly prescribed among her patients and are expensive. So costly, Saylor says they make clinical decisions they should not be making based on pricing instead of what a patient actually needs. She says this change will have a major impact on not just her patients, but all Mainers who need these medications.
Patients, I find, often are making choices not to take necessary medications at all because of the prohibitive cost associated with them. These are drugs that every drug in that class is similarly priced, so they have very few options. Patients are going into debt.
And seniors are expected to see these savings kick in about 2.5 years. Prices first need to be negotiated with drug companies, and some of them are already trying to block this program in court. Alex Haskell, News Center, Maine.